I'm Dr. William Parrish. I work at Tanner Primary Care of Bremen. I'm a family practice physician and I've been practicing here for 20 plus years. I wanted to say that I got the COVID-19 vaccine because it just made sense on multiple levels. First and foremost, I want to protect myself, my family, and my patients. I want to make sure that I'm doing everything I can to remain healthy and to help my patients be healthy as well. We tend to want to protect the things that are most important to us. And for me, my priorities are my family, my priorities are my job, and the people that I come in contact with every day. I have a wife and son. I have both father, aunts and uncles and in-laws, all in their 80s that are in a more vulnerable population. And the vaccine is truly safe and effective to help prevent myself as well as others from getting severe disease. And that can result in hospitalization, being placed on a breathing machine, or even dying. It really makes sense when you look at trying to be healthy and to take care of ourselves. It also makes economic sense. If I'm not able to go to work because I am sick, then I can't help provide for my family. My undergraduate major, some of you may or may not know, happens to be a business degree from the University of Georgia in risk management insurance. I worked for an insurance firm for several years prior to returning to school and then medical school. And this vaccine is the cheapest insurance that you can get. If you're like me, you spend a considerable amount of money protecting the things that are our priorities. That's our home, our cars, our health, even our lives. This vaccine can go a long way to help protect our lives. It allows us to have freedom as well. I want to have the freedom to be able to work without fear and worry that I could be endangering somebody else. I want to have the freedom to visit my family and friends and know that I have done everything I can to help protect not only myself but protect those around me from getting sick. I want to have the freedom to go to church and worship. That is a priority for me, and I want to not to have to be fearful that I might be endangering someone else, and I want to make sure that I'm doing everything I can to protect that freedom. I even want the freedom to do some judicious traveling and some entertainment options with my family. Therefore, I want to make sure I'm doing everything I can to protect myself and others. I just got a text earlier today that one of my 19-year-old's friend's father, who was 45 years old and with no significant health conditions, passed away today from COVID. I know that many of you have heard that the hospitals are overwhelmed. You may have had to wait 4 hours or so to be seen at urgent care or come to our office to be tested. This virus is putting considerable amount of stress on all of our daily lives, and I do believe that God provided a tool for us to use that will help prevent us from getting significant disease and ultimately dying, and that is the COVID-19 vaccine. We've given over 300 million of these vaccines in the United States, and they are safe. You do not hear of people dying from the vaccine. I don't know of anyone specifically that has died from this vaccine. It has undergone testing, and it's undergoing real-world testing. And that is good data that we can continue to use to help make decisions for our lives. I would encourage everyone to look at what you prioritize in your life, your health, your family, your ability to socialize and to worship, and to do the things that you would do if you prioritize something else in your life, which would be to protect it. And consider getting the COVID-19 vaccine for that protection. Both the Moderna as well as the Pfizer are very safe and have very good numbers, and I strongly recommend it because it just makes sense. It makes sense for your health, it makes sense economically, and it makes sense to help maintain your freedom of the things that you prioritize and cherish. Thank you.